First, healthcare workers doing what they can for victims of sexual violence in eastern DR Congo say that they've seen a distressing increase in cases. Those treating those targeted by sexual abuse say that since 2021, survivors, both children and adults, have increasingly been presenting with serious physical damage and psychological trauma after ordeals that local medics say are carried out by multiple armed groups operating in the region, some of whom are supported by neighbouring Rwanda or even the Congolese military itself. Emmet Livingstone brings us more from Kinshasa.
Women and girls are increasingly being deliberately targeted by combatants on all sides in the conflict in eastern Congo, according to a report released on Tuesday by the NGO Physicians for Human Rights. Cases of sexual violence are soaring. The UN documented 113,000 instances of rape or sexual assault in 2023, and figures from the first half of 2024 are double what they were this time last year. Conflict is driving the huge rise in sexual assault, and particularly the M23 conflict, which erupted 3 years ago and has displaced over 1 million people. Women and girls, who constitute the majority of survivors, are particularly vulnerable. The report, which is based on interviews with local health workers, also found that survivors often only seek medical care after brutally violent encounters such as gang rape. According to Physicians for Human Rights, there's a need to document the abuses in order to pave the way for justice.
What we know is that while many survivors do not want to go to court for justice, for survivors who do, these cases often fail due to lack of proper evidence. And this is a critical moment to be trying to collect that medical legal evidence, in particular for survivors, and to ensure that when they go to a health facility, they are not re-traumatized when they are seeking to have their cases documented and reported. So there is an urgent need right now to support the health sector to be able to receive survivors of sexual violence and to be able to ensure that the forensic evidence of the violations that they've occurred is properly captured.
The call for justice comes after this month the International Criminal Court announced it was renewing its investigations into crimes committed in DR Congo from 2022. According to Physicians for Human Rights, the perpetrators of sexual violence in the region range from militia fighters to Congolese soldiers and even UN peacekeepers. Many survivors often suffer complex medical needs, but the conflict has also severely degraded Congo's health system.